Thanks for joining me today. We're going to make this a little interactive. I'm going to start with just a little introduction to introduce you to the biofeedback and how we use it with stroke. And then we'll move into Christian will be doing a demonstration, and then Maddie will be doing a demonstration. So without ado, let's go ahead and get started. So the topic that we're going to be talking about today is how to enhance your home exercise program or rewire your brain with the use of biofeedback. So many people ask this question. So I thought it was the first one that we should just answer and kind of get off the table before we even get started. And the question is there a time limit for improving post-stroke? So after a stroke, is there a time limit? Do you run out of time? So in answering that question, I wanted to share a quote from Dr. Michael Merznick. He is a professor of neuroscience at University of California, San Francisco. He's a pioneer in research and brain plasticity. He's kind of known as the father of brain plasticity. So one of his kind of famous quotes in one of his books says, every brain is a work in progress. It is plastic from the day we're born to the day we die. It continuously revises and remodels, improving or slowly declining as a function of how we use it. So back to answer this question, we're going to have to say, no, there is not a limit on recovery post-stroke. So what the brain doesn't have in it, it doesn't have this calendar that says, okay, now it's been a year, today is your day, it was a year ago you had your stroke, so you're done, time's up, recovery is done. It does not know that. So what it does understand is how you move and how frequently you move. So improvement can be made well past a year and well into many years to come, months, years to come. Why people have the most improvement a year after therapy is just generally because they get more intensive therapy during that first year. That's when you're in maybe acute rehab, home health, outpatient therapy. So a lot of therapy occurs during that time. And then after that time, things start to decline and you're really kind of left on your own to figure out what you need to do to help continue to progress and recover. So as long as you stay motivated and you stay connected to people in the programs that can help you progress along the way, you can continue to recover. That is what neuroplasticity is about. It allows the brain to rewire itself and to continue to improve years down the road. What the brain cannot differentiate, though, is what is good movement or efficient movement and what is not so good movement or less efficient movement. So the brain learns movement, right? It learns what you do. If you do something enough times over and over and over, it learns that and it makes that pattern movement. It builds that neuronal network. So a lot of times post-stroke, you learn inefficient ways to move. So you learn maybe to lift, when you lift your arm, you maybe learn that you should bend your elbow. And that's just kind of a natural compensation that happens. We'll talk about that just a bit more. But if you do this enough times, right, that's what the brain has learned. It has learned a way to move it, which is maybe not an efficient way, a functional way, a good way to move. However, it shows you that it can learn. So you have to then have somebody that can help you learn and reprogram your brain to learn these efficient ways to move and get rid of the less efficient ways to move. That's where biofeedback can make a big difference. Next slide, Michelle. So we're going to talk about arm and hand recovery today. That is our focus. We could talk about lots of body parts, but this is where this lecture series is going to focus. So sometimes next slide, Michelle, sorry, I knew I was going to forget to tell Michelle to move with me here. There's common factors that generally affect everybody that limit arm and hand progression. And so I just want to cover a few of those. And I hope all of you kind of nod along and say, oh yeah, because those are some of the things, these common factors that are limiting. That's what TR Care, we're trying to help reduce those factors that get in the way of recovery. So I think the first factor that is a limiting factor is just the time that it takes for an arm or hand to recover is a longer amount of time than you see in a lot of times recovery with your leg, right? The arm and the hand, they're mechanically just very much more complex than the leg. They're not weight bearing. You don't walk on them. You're not using them with every step you take. So it's harder to recover because the mechanics are more complex. There's a lot more muscles, they're smaller, they're more intricate. So it just is a kind of a harder process to go through. And it takes a little bit more guidance. And also it takes a little bit more intentional active movement. When you walk, right, you're using your leg, you're strengthening your leg with every step. You don't always do that with your arm. So you're not actively moving your arm as much with everyday activity. Sometimes you may find throughout the whole day, maybe you're not even moving your arm at all. At the end of the day, you thought, gosh, I haven't even moved my arm out of my lap. That happens sometimes. Or sometimes maybe you're working with a therapist or somebody says, well, we don't see much active movement in your arm. Let's try some clasp hand exercises, right? So you clasp one hand over the other. And that's fine. Maybe it's going to help with a little bit range of motion at the joint or maybe at the elbow, but it's not going to do anything to teach the arm to move better. It's not going to help with increasing those signals to the brain that are needed for you to actively move your arm. All you're doing is really kind of teaching how to move one arm with the other. Insurance, right? That's another limiting factor. Sometimes just about the time you're starting to make progress in therapy, insurance says, sorry, you're done. You need to kind of go on a maintenance program. You can come back in 6 more months and be updated. And you're left to your own devices. And the shoulder and the arm, they're complicated. Most people don't, an average person just doesn't have the skill to understand how to progress or keep progressing. That's the key, right? Like continual progression, not stop at any one point, but continually to get better. The other kind of, I would say, problem with insurance companies is sometimes they like to tell therapists what they want recovery to look like. And then a lot of times they'll say, okay, this patient needs to make a functional improvement. They need to be able to do something functionally that they didn't do before they came into therapy. So that's when therapists maybe go into compensation. They teach you compensation. Well, most stroke survivors have learned compensation pretty well on your own, right? You kind of learn how to do things. So a lot of times you don't always need a therapist tell you how to compensate, but sometimes there's useful things such as maybe using a cutting board, a one-handed cutting board. If you can now make a meal using a one-handed cutting board, because you could cut up your vegetables and put them in the soup, and now you have independently made a soup. So that would be your functional goal that you have met. It may not involve any use of your affected arm at all, but it is a functional goal that's been met. So while compensation does have some benefits, it doesn't always align with the goals or the needs of the patients. People generally post-stroke want to continue to improve the motor function in their arm. So let's go to the next slide. I want to just explain to you anatomy just a little bit, and then we're going to go, because this is really going to affect how you understand how we use these sensors. So in order to continually progress, it has to be teamwork between your muscles. We're going to use the elbow joint here. Let me move my camera down as an example. When you bend your elbow, it is a combination and it is teamwork of 2 muscles. Right, Christian here, he's a better example here, right? So when he bends his elbow, his bicep is firing, all right? And then in order for him to extend his arm, the bicep has to relax and his tricep has to fire. The same thing when he bends his wrists, right? It's these wrist finger flexors that are firing. And then when he wants to extend it, these have to turn off and his wrist flexors have to fire. So there always has to be this coordination between muscles. And it's this imbalance that you see post-stroke. So generally after a stroke, the flexors, right, because you want to kind of hijack and take over the movement, they become stronger. So everything wants to bend in the arm. We're talking about the upper extremity now. So The muscles that work together no longer are working as a team. One's working more than the other one. And when that one works more, it doesn't even allow the other one to fire. So developing that balance is important. And one of the ways that we can actually do that way more efficiently is to see what's going on there. So next slide here. How do you know if you've had an imbalance in your muscle? I'd say almost anybody that's had stroke has had an imbalance of their muscles or does have. Let's just do a quick check here. If you notice there, you're sitting and your arm is across your lap, okay? That's probably an imbalance of muscle. All right, if you notice when you go to lift your arm, first you lift your arm, does your elbow bend? Does your wrist flex? That's an imbalance of muscle. Okay, when you walk, do you notice your arm draws up a little bit? Those are all indications that you have an imbalance of muscle. So next slide. So we're going to look at with this series, we're going to look at 3 ways to improve motor control with arm movement. First, we're going to look at how to improve your wrist extension and reduce wrist flexion. We're going to secondly look at how to improve elbow extension. All these we're talking about, you're probably going to hear us say extension a lot, right? That means the opposite of this movement, right? So how to improve extension, elbow extension, and limit the biceps. The biceps tend to fire too much. And then thirdly, we're going to talk about how to calm down or inhibit wrist flexors through weight bearing. Now, if you've been in therapy at some point in time, you probably have had an introduction to all of these, but maybe you haven't had anybody that intensely works on any of them. I've worked in the clinic for many years, and I know how it goes. You are so pressured by what insurance mandates that you may work a little bit here and you may work a little bit there, but you don't have hours and hours to dedicate to really help people refine movement to make the kinds of changes that they really hope to make. So we're going to break this down. Today, we're going to talk about how to improve wrist extension and reduce wrist flexion with EMG biofeedback. So we're going to look at the next slide there. And before we go into kind of some live demonstrations here, I wanted to just show you what an EMG, how it worked and what it looked like. So an EMG is a sensor. I've got one here on my hand. Okay, this is just a little sensor, and you put it over the muscle, and it detects the activity of the muscle. So you put it on the muscle belly, and then it will detect any activity that is occurring. So sometimes the muscles are firing, and you don't even know they're firing, or you're not intentionally trying to move the muscle. But if the muscle's firing, it's going to pick this up, and it's going to tell us. Sometimes you may think that you don't have any movement at all, and you put a sensor over your muscle, and you maybe you can't even see the movement, but the sensor can detect the movement. So by using sensors on the muscle, and I'm going to kind of still, I think it was Chris, actually one of our super users, that said that it's like a cheat. You can kind of actually see like a glimpse into the muscle to actually see what's going on without actually, right, being able to go into the muscle and see what's going on. So if you look at this graph here, these are 2 sensors that we had put on somebody. The blue line we put on the wrist extensors. We'll demonstrate that here in a minute. And the red line is a sensor that we put on the wrist flexors. So normally you're going to have a little bit of movement in each. So that is what the first graph shows us. Typically, you always want to have anything that you do, you really want a little bit more extension than flexion. You don't want flexion to hijack the movement, because then that turns into this. If you look at the second graph over here, this shows that the red line is the wrist flexors. So you can see this person was having a hard time turning off their flexors. We were asking them to use their extensors, and they couldn't necessarily always find the extensors. When they were trying to use the extensors, they were actually firing the flexors. So unless you put something on that helps you learn this or see this, you really don't know what you're doing. And most clinicians in a clinic don't know either. They may put a splint on your hand and try to stretch you out and then say, okay, when your hand's stretched out, then we'll work on your hand and wrist. But if you keep waiting and waiting, what is that right time, right? Like the longer you kind of get down the road with the hand, the more complicated it becomes. So by using the sensors, you can kind of act on that a little bit more efficiency and a little bit quicker than is typically done in a clinic. So EMG works and biofeedback helps you really gain physical and mental control over your movements. If you don't know what you're doing, you have no control over it. So by using these sensors, you see what you're doing, and then we help you find ways, strategies, exercises to help you gain control over that movement, improve the good movement and inhibit the not so beneficial movement. So Maddie's showing you that her affected side is her left side. So she has a sensor in her hand, and she's going to show you how she puts that on her extensors. So this extensors have an adhesive back.
It looks like this when you take it off. So it's like I have little stickers that you put on. And if I want to put it onto my wrist extensors, like you can like kind of see my arm. I was told trace a line up from like your ring finger, basically up to where right below your elbow, or does that make sense? You know what I'm trying to say? So if I go up here, like right to the top part, and then I just stick it on.
Yeah.
And now.
Yeah. So before Maddie started, she didn't know where to put her sensors, right? So it came pretty easy, didn't it, Maddie? That wasn't the hardest part. So Maddie has gone into her graph view now. And so this is her arm at rest. She's not doing anything. Maddie's been practicing. She's been working hard. So when you put the sensors on, you really want to establish what is the baseline. And so you can see with Maddie here, look at her legend here, her flexors are red and her extensors are blue. Flexors are the ones that tend to dominate and that we want to turn off a little bit. So you can see on Maddie's graph, she's pretty tight together, but on the first part of the graph, you see how her flexors were on top of her extensors. That means the effort that the flexors are firing is greater than the extensors. So initially, those flexors were kind of winning the battle here. So what we would want, and she's gotten closer together now, is to pull the flexors down and the extensors on top. So that's what we're going to kind of show you some things here. We're going to switch back to Christian now, but I want you guys to understand this baseline, right? How it looks. See, she's changing it now. If you see as this graph progresses here towards the end, you can see that the red line is not clearly on top of the blue line. And Maddie, you want to tell us what you're doing to make that appear a bit different?
So I don't know. I just kind of think a lot about relaxing the muscles, because I know that like a lot of times when I do make a muscle exertion, it comes from the more incorrect muscles, the flexors. So I visualize like the muscles just calming down, or I'll think about like one finger specifically.
Maddie, has it been 6 years, Maddie, since your stroke?
About to be 6, yes.
Okay. So Maddie has had really kind of 6 years of, I don't want to say the wild, wild west, but nobody has really ever, helped her refine her wrist and hand movement, because it is so very difficult to do. And if you don't actively gain control of this, you can use any kind of splint, any kind of device you want. But if you don't actively gain control of this, it's not going to change. There is not a device that is going to change you. Your brain has to change you. So if you look at Maddie, we would start with her hand in a position that she would have the most control. And because even though still her flexors are firing a little bit more than extensors, there's not a great distance between them. So we'll just kind of show you some different positions that Maddie goes into. One of the positions that we're working with is getting her arm away from her body, just resting it beside her resting on her arm. Because again, it takes that kind of synergistic portion away. So Maddie, can you put your hand on the side
One
of your...
thing, Renee, if I could interject really quickly, that
Sure.
I've noticed since I've started with the biofeedback therapy is like, I used to just like, move my hand very rapidly, but like now Renee is having me think more about transitional movements and keeping my wrist extended like this when I'm transitioning to a different position. So I'm thinking about extending my wrist while I pick up my arm and move it like onto the armrest. That was something I didn't really do before.
Right. So did you see how, when she moved, like how much movement she does have when she changes positions, right?
And look,
So
the blue is kind of on top of the red, or it was a minute ago.
Right. So she switched it around now, right? So now her blue is a little bit higher. And honestly, I think it has to do with the fact that she's sitting here talking about it and watching the graph at the same time. So the more that you think about it, the more that you recognize it, the more you can help change it. So on the graph now, you can see that Maddie's extensors are firing a little bit more than our flexors because they're on top. The line on top is the extension. Extension is always better than more flexion.
And this took time. Like if you can remember, Renee, when I started, like it was very, very hard to get the blue on top of the red. And now I'm like getting it more consistently, which I think I consider as a big improvement.
So one of the other things that we do, we kind of said, Maddie, let's look at your ability just to extend your wrist. And that was kind of a hard movement, still is a little bit hard. So if we ask Maddie to lift her wrist up, to extend her wrist, she can do it, but you can kind of see her flexors weren't there, right? But her flexors fired, but she then gained control of them. So now she's got her extensors firing a little bit more than her flexors. So that's important that she's breaking them apart and she's now not letting the flexor dominate. Now, it's not to say that we still don't have some work to do because we would like to get those flexors even a little bit lower. Maddie, what if you just straighten one of your fingers? So sometimes we break down the task. If asking something as big of a wrist movement is too much, we may say, okay, go back to that visualization, that imaging, and see if you can just extend your wrist flexor. So you can see how the sensor picks up the different amplitude of the muscle, because when you extend your finger, right, you're not using you're not straightening your whole wrist and your whole fingers. So you can see the measure is different here, as it should be. It is smaller. And so she's doing a little bit of a better job here, keeping her extensor on top of the flexor. So that's one of the things. The other thing is that Maddie really likes standing. So Maddie, let's go into standing. And again, she's going to think about it as she comes to standing, maybe more so than she did before. So Maddie's going to do a similar exercise, but she's going to push she's extending her wrist against the edge of her table. And I want you to watch that blue line there and see what happens as she pushes. So you see the recruitment, right, of those extensors that she's using when she just pushes against her desk. Maddie, can you lower your camera maybe just a little bit more?
Is that better?
Yeah. So see how simple task. Have you ever thought of this, right? Just pushing against something firm. You can see how much more she's using the extensors and how much less she's using the flexors when she does that.
Yeah, I seem to like the standing up position and like doing wrist exercises while pushing against something. Seems that I have good luck with activating my extensors.
Okay. So now she's going to show you, we just kind of stumbled upon this next activity. Maddie's going to show you what she does when she puts something in her hand. So when we very first started working, as soon as Maddie put anything in her hand, like her flexors fired. So I'm like, whoa, Maddie, we got to keep things out of your hand right now. The other day, I'm like, okay, let's just try this again, Maddie. Let's just see what happens when you put something in your hand. So she had a stapler beside her. So she grabbed the stapler, because sometimes actually using something that has a little bit of weight to it and that it's hard sends a message to the brain about what the hand should do. Now, sometimes it's a positive message in that it learns to grade the task. Sometimes it's not such a positive message, and the flexors just go crazy and start firing. But this shows, when Maddie put that in your hand, this shows the control now that she has learned to use in her hand. Her flexors are really not firing any more than her extensors. Remember when we showed you that first picture a while back of how when the two muscles need to work together? As the blended line right here, it shows you her two muscle groups are working together. Her flexors and her extensors are working together. So that's the first thing that we would want to see. Now, this did not happen though a couple of weeks ago when we did that. So now we would say, okay, Maddie, now when you hold something in your hand, normal movement is a tiny little bit of wrist extension. So let's see if you can add just a little bit of wrist extension to that. And she's starting to pull it apart just a little bit there. That blue line.
A little bit. There we go.
Yeah. That blue line comes on top. So this is a real big success for Maddie, because her anytime in the past, her flexors just went crazy. And then we're going to say, well, Maddie, you're looking pretty good that. Before, Maddie did not move her palm up or down at all. She always kept her palm flat with everything that she did. But she has the weight of the stapler in her hand that is actually going to help her a little bit. Well, so we're going to say, Maddie, can you actually even start working on maybe trying to turn your palm up a little bit? And look what happened to extensors. She's using her extensors a little bit more than her flexors. And she's added even a little bit of supination onto that. There you go. So any peak that Maddie makes on those extensors have been really, really amazing progress.
Whoa, that one was really good.
Right. Maddie, do you have anything to add into this here?
I would just say that I think it's really cool to be able to see like these progressions in real time as they're happening.
And move your camera up just a little bit so we can see you too.
Oh, sorry, you couldn't see me.
That's okay.
I think it's really cool to see the progressions happening in real time. And I mean, I know it's going to take a lot of work. Like I have improved a lot already with my ability to extend and like limit my flexors, but I know it's going to take a lot more of practice to improve that and get it even more consistent.
So kind of our recap that we know that arm and hand function can be slow. Like Maddie was kind of saying, it takes a lot of work and it takes a lot of effort. So it does take a commitment. But what we know that there's not a deadline, that your year post-stroke is not the end of hand and wrist recovery for you. Not to say it's not complicated and it doesn't take some work, but it's not the end. You can continue to make changes. That's the beauty of the brain, and that is the gift of neuroplasticity that you've been given. We do know though that the flexors tend to dominate. They tend to hijack movement, and the flexors have to be taught their lesson. They have to be inhibited. They have to be turned down, and the extensors have to be dialed up. Most people just don't get a chance to work the extensors because the flexors have become so prevalent and so dominant with everything that they do. And this wrist flexion is part of a synergistic movement. So learning how to work out of that movement, how to develop control at the wrist, at the elbow, at the shoulder, without moving your hand out of a hole is possible, especially when you know what your muscles are doing. Again, the brain cannot differentiate between good and bad movements or efficient and inefficient movements. So the more that you move in this kind of pattern movement, the more that becomes normal for you. And so learning how to break that pattern of abnormal movement is important to turning that abnormal movement into more normal movement. Biofeedback is a tool that can help you learn to do this. It gives you the ability to control your movements, to see your movements. It helps you gain that control to relax your flexors and to strengthen your extensors. And most importantly, consistency, repetition, repetition. With anything that you do that is important to rewiring the brain, it does take, like we were saying, a strong commitment. You can't do it one day, 1 week, and then wait another, I'm gonna do it Monday this week and I'm gonna wait till Monday of next week. You can't do that. It takes a strong commitment because you're trying to get rid of, it's just like breaking any other old habit, right? You have to break an old habit in order to learn a new one. And that's what you're doing when you rewire the brain. So that's all I have to say today. I'll turn it over to Kit, and then we're happy to answer any questions that you may have.